Hey, this is Kevin, medical lab technician working in the epidemic of the COVID-19 virus in the United States, sharing my journey and my experience and giving what information I can to those that may want it or may need it. So, one of the questions people have is what is this virus and why is it so bad? Because leading up to now, you may have heard things like, well, it's not even as bad as the flu, or it's just another virus, or it's fake news, which, that's been overturned and recounted, and I think I somewhat apologized about. But anyway, it's beside the point. So what is this virus? To understand viruses, what you have to know, or to understand this virus, you have to know that there are viruses that naturally inhabit animals, and there are viruses that naturally inhabit humans. A lot of these viruses that are in the animal kingdom, we'll say, typically don't infect humans and don't have any problem with humans. However, occasionally these viruses will mutate and gain the ability to then transmit from animal to human. Where this is bad, there's also the good news that normally when they jump from animal to human, they are not able to be replicated in the human and then transmitted from human to human, but to kind of keep just jumping from the animal to the human. But to make things worse, sometimes these viruses, once they've gained the ability to jump from animal to human, will then mutate and gain the ability to jump from human to human. That is what we're dealing with here, it appears. And why that is so bad is that virus itself, the actual nucleic acid or the amino acids that make up the chain that is the existence of this organism, we'll call it, its complexity is of the origin animal, or its makeup is more related to the ability to infect or coexist in that animal. And when it comes over into the human environment, the human does not really recognize it. Now we can bring it, mutate it, and replicate it, and then be able to pass it on to other humans. The problem lies that it's not a human virus. In other words, our immune system doesn't recognize it the same as human viruses that are passed around amongst humans that is of a human origin. When this happens, with there not being any natural immunity for the human, the virus is free to go wherever it wants to go. If you don't have a previous exposure to it or to something similar to it, or with it not being of a human originated virus, you have no protection against it. Now, when these come about, you may have heard the word such as novel, which basically means new, that this is a new virus. Well, in this case, this is a new virus that may have had the animal origin that jumped to human, that mutated and gained the ability to jump human to human. Now it can also mutate again and create different strains, and in this case, this virus has done that and is now currently in two different strains, we'll call it. There is the L strain and the S strain. One seems to be a little bit more aggressive than the other. Not that the lesser aggressive is anything to laugh at. Neither one is anything to laugh at. This virus is no joke. This is a very serious circumstance. So now that it's out in our population, worldwide, all the way around the world, some people didn't believe that it would reach the countries of the continent of Africa, or the countries in South America and places like that. But even on the continent of Africa, I'm not a geography specialist by any means, but I think that there's probably around 40 countries on that continent. Um, as of today, on March 22nd, I believe that there's more than 90% of those countries that now have this virus, if not probably 95 or better. Um, and it's just going to grow. It's just going to keep going. The only way to stop it is to stop moving completely. But we're probably not going to be able to do that. Now, with this virus out there, there's a thing that you may hear referred to as an R naught, and that's the letter R with a zero next to it. And this R naught is basically, we'll just call it a calculation, a basic calculation that shows how infectious it is. In other words, when one person gets it, how many more people will get it? It has a pretty high R naught. Now, it's not like the highest that we've ever seen, but it's up there. It's a pretty high one. Definitely higher than the flu. I mean, the seasonal flu that we encounter. So with that said, with no natural immunity and a high R naught or a high, contagious rating, it's going to spread very fast. And that's going to create so many problems. Now, what has to happen for it to be able to slow down is it has to basically infect so many people. So many people have to have been exposed to it and create some sort of immunity to it to be able to basically slow it down. A lot of people refer to this as herd immunity. And the best guess at this point, which is a pretty good educated guess, is that it would take approximately 80% of a population to already be infected by it or have some sort of immunity to it to be able to really slow it down and for it to not be a problem. So there's a long way to go, being that we're waiting on a vaccine and waiting on some better treatment. So if it gets to run free, it's really going to do some damage. Now, for people that are exposed to it, we obviously know that they are affected differently. Now, there's different reasons for this. In the elderly or somebody with a medical or an underlying medical condition, we know that the mortality rate or the complication rate of this is quite a bit higher than somebody that may be considered, younger and healthier. Now, don't be fooled. Even younger people can be affected by this very much. Now, kids, we're talking, under 20 and especially 10 and under seem to be, responding very well. Now, they'll test positive and they'll also spread it. But the physical effectiveness by the virus seems to be pretty minimal. Now, it doesn't mean that they get away, scot-free. There is a case incidence on those younger children. But I believe that even from the age 20 to 30 right now, we're looking at a rate of about 1 in 500 that get it will die. Now the rate goes up, with each category as you get older and with any underlying conditions. Another thing that affects how your body responds to it is by basically the dosage of it that you're exposed to, or the inoculation. In other words, how much of the virus were you exposed to? How many of the virus were you exposed to? It seems that the more of it that you're exposed to, either in one lump sum or a bunch of small exposures, seems to have more complication on the case. Now that explains why a lot of your healthcare workers seem to be really getting hit pretty hard with it when they seem to be healthy and young. I believe at this point, Italy, as of right now, had already lost 13 doctors. We know in China, we weren't getting the real numbers, but there were thousands of people that were affected by it there. I'm not sure how many healthcare workers had died, but it's going to be a real problem. It's going to create a lot of problems for staffing and for treating, and it's it's an awful thing for morale when your healthcare workers start falling sick to it, and even worse so whenever they start passing away and dying from the disease. So, you know, it's a serious thing and it's real. And I don't mean to be fear mongering or anything, but you know, the facts are the facts. We were a little slow. The whole world was a little slow to react. Some countries more than others, but right now, you know, as of March 22nd, 2020, Italy is screaming to the other countries, you need to do something now because it is going to be too late if it's not already. So, wearing masks here in the United States, it may be too late for the mere fact that the supply is pretty much gone. And, working in the healthcare industry, we didn't even have them to begin with. By the time our facility was wanting to use them, you couldn't get them. We were weeks outside of even being able to get them at that point. And a lot of people were saying, that masks didn't matter. Well, that's not true. And some people were saying, well, only certain masks for certain people made a difference. And that's not true either. The fact of the matter is that a mask, just a regular surgical mask, if everybody is wearing one, you have your people that are infected, that are sick, or maybe not sick but infected, that are shedding the virus. If they're wearing a mask, it's slowing down how much they're putting off. And if you have a healthy person, even in the vicinity of them, and they're wearing a mask, it is going to cut down a little bit on their exposure. Now, if the whole population is wearing it, it slows it down. And there's proof, and in the recent data for this, and that is whenever South Korea started to get infected, and it came on fast. Their healthcare workers threatened to strike if the public weren't required to wear masks, and if the country wasn't going to shut down their borders or city, however you want to refer to them. But anyway, so they pretty much enacted this, and as of last week or even into the week before that, their regular flu season, which normally wouldn't be over till late April into maybe late May, somewhere in there, it's ended. It's already gone. Now they're still combating the coronavirus, but in fighting the coronavirus and masking everybody, they actually stopped their flu season. Now, if somebody wants to say, oh, well, it's not as bad as the flu, more people die from the flu, I have to ask, well, why aren't we doing anything about that? We do all these vaccines, but you're telling me that all these great numbers of people are dying from the flu, the seasonal flu, then why aren't we wearing masks and slowing things down when we know for a fact that it is effective? Anyway, that's beside the point. I guess that doesn't have anything to do with what this virus is and why it's so bad. But there you go. I'm sorry it was a long video just to explain all of that, but maybe you didn't understand and maybe that helps. So if you want, keep following me. I'm going to do a journal as long as I can. Backtrack and look at my other videos and find out maybe what started this and what's happened up to this point. Follow me on through. I'm going to keep doing these videos at work and outside of work, documenting my experience as a lab technician in a hospital, going through this epidemic and this experience. I'll keep doing it until it's over, or if I get sick, or if I get too sick to do it, but this is my journey. This is my journal through this epidemic, and you're more than welcome to follow along. Like and share the video, subscribe. Please pass it around. Somebody may get information out of one of these videos that saves lives, and that's huge. And maybe you're going to know something that you can share with me that I could share with other people in the facility that's passed it from facility to facility and saves many lives. So I want you to be safe, and as I've been saying, welcome to the new normal. Welcome to the new normal. It might be temporary, but I believe it's going to be for a little while. This new normal is, it's a little bit different. So I hope everybody stays safe, and we'll see you.